Hi guys, my name is Josh, and I've been dealing with a herniated disc in my back. It's been a long journey. It's been a short period of time, only 7, 8 months, but it's been a long, horrible journey. uh, Started back in November 2025. Don't really know what caused it. Just kind of started flaring up, and then around Christmas 2025, I was calling out from work and having issues with not being able to just kind of do daily tasks. Nothing too severe at that point, but like getting out of bed in the morning was really difficult. It's almost like I had to warm up for the day, and yeah, it was really frustrating. I ended up going to a doctor, getting an x-ray. They said I had a herniated disc. I went to physical therapy, of course, after that to take care of it. Did 3.5 months of physical therapy, and it wasn't helping. Things were getting worse. I was trying things like going to the hot tub, going to do ice baths, doing saunas. Even did a little bit of therapeutic exploration, I should say, with some healing peptides. I'm not going to go into any details with those, but if you want to know any more information about them, feel free to message me. The benefits I felt were, I don't know, I felt like they were minimal, any benefits they did provide. I also went and did, I was doing all the exercises, like I was doing them all the time, and my work is fairly uh, easy to be able to focus on and do those exercises. I work as a data analyst, and so there's a lot of time sitting. I do have a standing desk, so that's a modification that I made to my life to be able to try to figure out this issue. So things weren't getting better after physical therapy. I then went and got an MRI in April because I started experiencing something called drop foot in my right leg. Um, if I didn't mention, I don't think I mentioned this before, but I had I guess the bulging disc on the right side from the x-rays, what they could tell. And so of course, all that pain goes down the right sciatic nerve. I went and got an MRI in April, so I'm about 5 months into this journey now, 6 months, and they found two bulging discs to the left side, and they found a ruptured or herniated disc to the right side with about a 10 millimeter extrusion in there. They said it was a little difficult to do measurements. I was pretty anxious going in, getting an MRI. Had never had that done before, but they pretty much told me that about the size of my pinky is what the hole was. So since the MRI, I kind of doubled down on my efforts. I really tried to do more physical therapy. I tried to get more rest. Tried to, the best thing that was helping me was a lot of ice, a lot of hot tub, just going back and forth between those, just trying to get it down. I used TENS units. I even got a travel TENS unit so I could just wear it all the time. And those were actually pretty nice. I did multiple long trips, and I did a 6-hour flight to Florida, and I was able to more or less endure the trip, but it was painful with all those things. I was prescribed, I don't know how many kinds of medication for this illness. I went from everything from ibuprofen, Tylenol, to meloxicam, to pregabalin, which is called Lyrica, to just different versions of muscle relaxers, and they each had their pros and their cons, and I found some to be more beneficial than others. I found the side effects of Lyrica to be pretty extreme as far as my day job goes, being a data analyst. Being able to focus was a hard one. I'm having a hard time focusing now, so that's kind of a bummer. But hopefully, I got some positive stuff coming up here in the future. I got my MRI results, and like I said, doubled down on my efforts, did more core strengthening, try to do as much as I could in the gym without putting a lot of strain on my back. Did a lot of planks. I even bought a reverse hyper extension machine, if any of you guys know what those are, to try to strengthen my lower back and improve any, I guess, unstrengthened portions that were there. And it just wasn't working. I was referred to surgery, and I was not wanting surgery. I really wasn't wanting it. And I went to a specialized spine care clinic that is, a non-surgical approach. It was kind of cool. They had a 3-tier system. They had physicians, they had chiropractors, and they had physical therapists all in one building. So I'd never seen that before. But unfortunately, they wouldn't touch me. They said they don't touch anything above 5 to 7 millimeter extrusion from those discs. So I was outside of that range, and yeah, so I was pretty depressed after hearing that. I think that was kind of the nail in the coffin. That was just like, hey, if a chiropractor doesn't think they can fix it, then I guess you got to go to a surgeon and get it fixed. I did do a lot of decompression therapy. I should mention that. I was on traction machines for 3 times a week, I think, for about 40 minutes each time. And those were nice. I definitely don't discount the ability in a traction machine if that works for you, if you can recover from that. But the effects of it were short-lived. I would get my decompression therapy, and I'd feel good for about 3 hours, and then it would come right back. So I met with multiple surgeons. I would suggest that if anyone's looking at getting a microdiscectomy surgery, that you should definitely talk to multiple surgeons and get their take on it. The thing for me is the surgeons didn't exactly say different things about the surgery. I think the second surgeon just kind of made the point, like, hey, you've waited too long, but that's okay, like, we can still fix this. You got a life to live. I got 3 small kids that I want to get back to, running around in the yard with. And that surgeon was just kind of like, hey, let's get this done so you can move on in life. And they just made me feel a lot more confident and comfortable in getting the surgery. Now, having said that, my surgery is today in just a couple hours, and I'm pretty anxious. I got a lot of thoughts running around my head. I have a lot of support, so that's good. But I just wanted to make this quick video and kind of tell my story and let people know the things that I've tried. Because when I was looking up this injury, I don't know. I was finding a lot of. Sorry, I got an airport nearby. I don't know if you guys can hear the airplanes going overhead, but I tried a lot of things, and I just didn't have a contact to be able to say, hey, did you try this? Or hey, did this work for you? And I just felt like I was Googling a lot, so I wanted to, put myself out there and say, hey, ask me your questions. If you tried this, or if this worked for you, I'd love to hear it. I feel like I kind of tried all the options that I could. I did ask about even therapies that were a little bit outside of this area, such as stem cell and I guess plasma-rich therapies, and those just weren't, after kind of asking the questions about those, they didn't quite fit what I was trying to accomplish. So I'm not saying that those can't help you, but they weren't going to work for me. I even got a Claudial epidural, and it kind of sucks because I was really hoping to get a lot of relief from that. I was hoping that it would help me in getting my exercises more under control and being able to just really strengthen that lower back and maybe persuade my body to kind of reabsorb a lot of that disc material. And unfortunately, the epidural it did nothing. Like I all I could tell was from it was, I mean, my back pain was still there. I was just missing about $600 to $800 out of my checking account, and so that sucks. But I hear that some people get benefits from those, but it just didn't take for me. Okay, well, hopefully I will be providing you guys with an update video after my surgery, and I'm planning to kind of do one like immediately if I can. I don't know, we'll see how it goes, but somewhere in the first week, and then provide some more update videos about that afterwards. So send me any questions, let me know your thoughts on how your journey is going for your back injury, and yeah, thanks.